Peptic ulcers can develop potentially life-threatening complications such as bleeding, penetration, perforation, or obstruction. Most peptic ulcers can be cured without any complications. Bleeding. Bleeding is the most common complication of ulcers, even where they are not painful. Vomiting brown clumps or red blood, partially digested blood, known as hematemesis. Passing black, tarry stools, it's so-called melanoma, or visibly bluey stools, it is called hemoptysia, are potential symptoms of a bleeding ulcer. Blood loss from a bleeding ulcer can also result in systemic symptoms such as weakness, a drop in blood pressure upon standing, it is so-called orthotic hypotension, sweating and fainting. Despite advancement in the management of peptic ulcer disease, the mortality rate from peptic ulcer bleeding has remained steady at approximately 7 to 10% in recent years. Perforation. Ulcers on the front surface of the duodenum, or less commonly the stomach, can go through the wall, creating an opening to the free space in abdominal cavity. The resulting pain is sudden, intense, and steady. The pain rapidly spreads throughout the abdomen. The person may feel pain in one or both shoulders. Breathing deeply and changing position worsens the pain, so the person often tries to lie very still. The abdomen is tender when touched, and the tenderness worsens if a doctor presses deeply and then suddenly releases the pressure. Symptoms of perforation may be less intense in older people, in people taking corticosteroids or immunosuppressants, or in very young people. A fever indicates an infection in abdominal cavity. If the condition is not treated, shock may develop. Penetration. An ulcer can go through the muscular wall of the stomach or duodenum and continue in an adjacent organ, such as the liver or pancreas. This penetration causes intense, piercing, persistent pain, which may be felt in another area of the body other than the area involved. For example, the back may hurt when a duodenal ulcer penetrates the pancreas. The pain may intensify when the person changes position. And obstruction. Swelling or inflamed tissues around an ulcer or scarring from previous ulcer flare-ups can narrow the outlet from the stomach or narrow the duodenum. A person with this type of obstruction may vomit rapidly, often regurgitating large volumes of food eaten hours or days later. A feeling of being unusually full after eating, bloating, and lack of appetite can be a symptoms of obstruction. Over time, vomiting can cause weight loss and degradation.